Hello all. So now we will discuss something about the vitamins and their general properties. Vitamins are the essential food factors which are organic in nature. They are occurring in natural foods. They are synthesized in the body, required in minute amounts for normal growth and reproduction. Classification of vitamins. Vitamins are classified basically into two types. They are fat soluble vitamins and water soluble vitamins. Fat soluble vitamins are vitamin A, D, E, and K, whereas water soluble vitamins, these are the vitamin C and B complex vitamins. The common properties of vitamins. Fat soluble vitamins. The common properties of fat soluble vitamins are: the first properties, they are soluble in fat. Second, bile salts and fat are essential for their absorption. Third, they are generally stored in the liver. Fourth, normally they are not excreted in the urine. Then the general properties of water soluble vitamins. They are soluble in water. They are easily absorbed. They are not stored in the body except vitamin B12. They have a threshold for urinary excretion. The next thing is about the fat soluble vitamins. Fat soluble vitamins. Here, first one is about the vitamin A, or also known as retinol. The chemistry of vitamin A. Vitamin A is derived from beta carotene. There are two forms of vitamin A derived from beta carotene. They are called as vitamin A1 and vitamin A2. Vitamin A1 is retinol, which is an aldehyde, and vitamin A2 is 3-dehydroretinol. The sources of vitamin A, the animal sources, are mainly the liver, milk, egg, and fish. The vegetable sources of vitamin A are like carrots, vegetable oils, green leaves, yellow fruits like mangoes, etc. The functions of vitamin A. The first one is they are essential for growth, they are essential for night vision, they maintain the health and activity of epithelial tissues and glands, they prevent infection. Fifth one is they maintain nutrition and functions of nervous tissue, they help in normal fertility. Effect of deficiency of vitamin A. Deficiency of vitamin A is known to cause night blindness, or it is also known as nyctalopia. Deficiency of vitamin A also causes xerophthalmia, which is the dryness of eye. It also causes retardation of growth in children. It can also cause defective growth of bone and teeth. The daily requirement of vitamin A is 5,000 international units for adults, and it is 6,000 to 8,000 international units for growing children during pregnancy and lactation. So this is about the vitamin A. The next thing is about vitamin D, or it is also known as calciferol. The chemistry of calciferol. Vitamin D is chemically a sterol. It is derived from ergosterol and 7-dehydrocholesterol. Ergosterol undergoes cleavage of bonds by the ultraviolet radiation from sunlight and forms ergocalciferol, that is vitamin D2. Vitamin D2 is formed in plants. 7-dehydrocholesterol undergoes cleavage by ultraviolet radiation from sunlight and forms cholecalciferol, that is vitamin D3. Vitamin D3 is formed in exposed skin. The sources of vitamin D are: the rich sources are the liver and fish, egg, butter, they are also good sources. Vitamin D is not well distributed in nature in active form. The functions of vitamin D: first function is it favors calcium and phosphorus absorption from the intestine. It helps in the bone formation by direct action on bone cells. It helps in the normal development of teeth. Effect of deficiency of vitamin D. Deficiency of vitamin D causes defective bone growth, condition known as rickets in infants and children, and osteomalacia in adults. Formation of teeth become defective and it leads into the development of dental caries. Deficiency of vitamin D can also cause tetany in infants. The daily requirement of vitamin D is 200 international unit in adults and 400 in infants, children and women during pregnancy and lactation. The next thing is about vitamin E, or also known as tocopherol. The chemistry of vitamin E, it contains a group of compounds called as tocopherols. Tocopherols are methyl derivatives of the parent compound tocol. There are four types of tocopherols seen in vitamin E. They are namely called as alpha, beta, gamma and delta. The sources of vitamin E are the animal sources are mainly egg, milk, fish and mussels. The vegetable sources are seeds, wheat, soya bean and corn. It also has been produced synthetically. The functions of vitamin E, it prevents sterility. Second is it is essential for fetal development. Third one is it is required for normal functions of muscles. Effect of deficiency. Deficiency can cause muscular dystrophy in old age and also it can cause sterility. The daily requirement is 15 to 20 milligram in all age for both male and female. The next thing is about the vitamin K. Chemistry of vitamin K. Vitamin K has got anti-hemorrhagic activity. The substance in vitamin K related to this activity is naphthoquinones. There are two types of vitamin K are there. They are called as K1 and K2. Vitamin K1 is originally found in alfalfa and vitamin K2 is originally found in putrid fish meal. The natural vitamin K are fat soluble vitamins, but the synthetic vitamin K are soluble in water to some extent because they are lacking the long hydrocarbon chain. The sources of vitamin K are mainly the cabbage, tomato, and soya bean. The functions of vitamin K, it catalyzes the formation of prothrombin and factor 7 in the blood and helps in the normal coagulation. The deficiency of vitamin K can cause defective blood coagulation due to reduction of prothrombin and factor 7 in the blood causes hemorrhage. The hemorrhagic disease in the newborn is believed to be due to the lack of vitamin K. The daily requirement of vitamin K. Normal mixed diet supplies adequate amount of vitamin K. In the treatment of certain hemorrhagic diseases, 5 milligram is given either orally or injectably. So this is about the vitamin K. Thank you.